So we're waiting for Nell. Hello. Nell's here. Dr. Nell. Hello.
Hi, how are you?
Good. My background's a little different. I'm at home today, so
I'm also at home, so.
I know. But I still need to go back to the office. So
Okay.
yeah,
All
it's one of
right.
those things. We're in a warehouse, right? So we can't really not work we can't
Yeah.
really work from home because all of my inventory is there.
Yeah, exactly. Do you have any employees who are working from home?
No. So all of us are either taking time off or all of us are just working there. We recently have someone that decided to take time off, so she's coming back today. And then we hire someone new, so she's on the training wheel.
Okay.
I know it's exciting time, but it's also nervous. So I always have to ask this common question now. Are you okay wearing a mask working? Because if you're not, then it's probably not going to work during this time.
No, exactly. We're all having to adjust.
So it's about 9 o'clock right now. I see a couple folks joining already. I want to be most respectful of your time. So we're just going to get started. And I know people usually roll in a couple minutes or two a little bit after.
To
so,
cycle in and out.
yeah. So thank you so much for joining us this morning. I really appreciate it. I know we went on live once together, but this is an opportunity for us to discuss with you about how you're adopting to remote patient care. So essentially telemedicine for your clinic with our changing society, with the way that our society is working right now. It's harder and it's hard to see patients in your clinic, and some may not feel comfortable. So how are you seeing your patient differently these last couple of months?
Well, let me first say I am still open just as an essential healthcare provider in California. That's not the same in every state. And I think even if you are, choosing to keep your clinic open, you still have to make adjustments.
Yes.
So, like you said, and it's sounding a little crackly on my end. Can you hear me okay?
I can hear you.
Okay. Um, so I think, there is also an expectation on the part of a patient that some type of adaptation has been made at this time. So even if, my clinic is still open, I'm doing a lot of work with telemedicine. Any new patients do an initial consult through telemedicine first before they would even come for acupuncture. And then I have a lot of people who were only doing telemedicine, and through that, doing acupressure. The big one is herbal consultations, which we'll certainly talk about today. But also just like how Chinese medicine works. It's a holistic system. We're not just talking about one modality of acupuncture. You are talking about herbal medicine. You are talking about nutrition, and talking to people about their lifestyle right now and what adjustments can we make in someone's life so that they are more comfortable at this time. And so it's been a lot more talking. I always, and acupuncturists can relate to this. When you have someone come into your office for needles, you end up speaking to them for some time and you're talking about things beyond needling. And so that's really how you bridge the gap with telemedicine is like, okay, look, we're still doing your session, but it's going to look a little bit different this time because there's not going to be actual needles involved. So I've had people that I've done just herbal medicine consults with. I've had people that, we do kind of a consultation. Initially, I'll prescribe herbs and then they'll have a few follow-up sessions of acupressure. The nutrition we'll talk about, and then also, okay, what do they need to be tweaking in their day-to-day lives and how do they incorporate that treatment plan? Because that looks different. People aren't going to events anymore. Their lives have completely changed. At least the structure has. So their lifestyle also changes. So my lifestyle implementation of a treatment plan is obviously going to look different.
So you mentioned earlier that you say you do a lot of herbal consultations. I mean, do you stock more herbs now, or do you leverage some resources to help you give herbs to your patient? How does that work like? Because they can't go to your clinic. I mean, they can, but they
Right. But
probably
most
don't
people
want,
aren't.
yeah, they
Yeah.
don't want to go to your clinic and say, hey, let me just go pick up herbs.
Right. So I'm actually using the same type of resources that I have in the past, but just more.
Mm-hmm.
So I drop ship to patients. I
Mm-hmm.
don't keep a heavy herbal inventory in my clinic anyway.
Mm-hmm.
In the past, I've always, kept some herbs on hand if someone came in with something really acute that they needed taken care of. But for the most part, I drop ship through Crane. Crane herb is, as you know, obviously, but not everybody who knows
Yes.
who's watching is a distributor for KPC and for other manufacturers as well. But their custom formulas are
Mm-hmm.
done with KPC granules.
Mm-hmm.
So what's really nice about that is I like being able to talk to my patients about knowing the quality of herbs,
Mm-hmm.
and patients are very conscious of that right
Yes.
now, obviously.
Yes.
They've always kind of been that way in California. People are very health conscious. They have a lot of questions. They want to know what's in what they're taking. But now, people want to know, particularly about Chinese herbs, like, okay, where is this coming from? Has this been tested? Like, am I, going to be okay taking this? I like being able to answer those questions confidently. Quality is extremely important for
Yes.
me in my practice, and I'm here in Beverly Hills. So I've always used a lot of KPC product and I've always used Crane, but Crane's been amazing lately because I can literally just go online, enter in the formula, and I can customize it, or I can do a patent formula and then it gets drop shipped to patients. So that's been the easiest way.
Mm-hmm.
A lot of doctors here are also doing like a curbside pickup
Mm-hmm.
situation where they'll have someone run out the formulas. That's an option too if you're actually in the office. But I'm in the office twice a week. And patients need herbs, 7 days a week. So it's very easy to be able to hop on my computer and go through Crane and send that. And I've actually found that patients are more open to herbs now than
Mm-hmm.
they have been in the past. Um, California is not a super resistant state to herbs
Yes.
anyway, but people are more willing to try an integrative approach at health right now.
Yes.
They're looking for more options, and being able to communicate about how herbs work and how it can help them is really
Mm-hmm.
important at this time. And people do have more of an open-mindedness to what additional things can I be doing to supplement my health.
Well, what kind of things do you kind of share with your patients when maybe their first time trying herbs and said, well, I'm open-minded, I'm willing to try, but I'm unfamiliar with this. So how do you kind of go about educating them and helping them understand this is not something that we cook in a bathtub with a whole bunch of herbs in it?
Right, exactly. Because I think in the past there's been this misconception that, oh, like you need to be in like the back of a cave with your cauldron,
Yes.
like stirring up your herbs. And raw herbs are amazing. They're very effective. They're very fast acting and potent, but being completely realistic, that is not going to fit into most people's lifestyles. And
Yes.
what is really affecting people's health right now is their lifestyle. So
Yes.
you don't want to introduce an additional stressor into a
Mm-hmm.
stressful lifestyle.
Oh,
So
yeah.
if you can take that pressure off the patient and say, like, look, this is going to be really easy. We can either do this as a powder where you're literally going to mix it in some warm water, or we can encapsulate that powder. My preference is to encapsulate the powder. Particularly with herbs that people are taking right now, they're not necessarily going to be like something that people love the taste of. A
Oh,
lot of
yeah.
patients do, or they don't mind it. But for convenience sake, I like the capsules. And for people who still want to have the experience of a tea, I just tell them empty the capsule.
Oh, that's a great idea.
So it's very like easy for them to take the capsules, and then they're like, oh, in the evening though, I don't mind taking it as a tea. I want to try it and see how it is.
Mm-hmm.
So that's generally how I do that. And explain to them also that this is not like it was years ago, that these herbs actually go through testing. And they're manufactured like pharmaceutical grade. So people are really paying attention to, A to Z, all of the steps that go
Mm-hmm.
into them getting these herbs and ingesting these herbs. Um, The other thing that I explain to patients with herbal medicine is that, because they always are like, well, if this is for my sleep, like, how's that different than an Ambien? Like, why can't I
Yes,
just take,
yes.
like, is it going to knock me out? Like, what? And so I always explain to people, herbs and pharmaceuticals work very differently.
Mm-hmm.
You might have the same effect of seemingly better sleep. Let's go with that example. But with herbal medicine, you are working with the body's natural physiology,
Yes.
so rather than against it. So a lot of times with the pharmaceutical medication, and this is nothing against pharmaceutical medication,
Mm-hmm.
this is just how they work. And sometimes that's really necessary, for trauma, for acute things. Like, I get it. But it will often shut off a signal or
Mm-hmm.
shut down a symptom, rather than actually working to address the underlying cause of that symptom. So insomnia is a symptom,
Mm-hmm.
what's going on to cause you to not be able to lose sleep. Herbs are going to work on what that cause is. And that cause is different for every individual, even if it's two people who constantly wake up during the night, the cause of that is different.
Yeah.
And the synergy of herbs and how specific we get with the mixing of those herbs and how they're put together in a formula customized for an individual is what's going to give you an optimal result. So you can absolutely, go online and see that there's something that's good for sleep or good for stress as far as herbs go. But that's not going to give you an optimal result. It might help a little bit, just like melatonin helps for some people. But for a lot of people, it messes with your endocrine system. So, but if you have a practitioner who's able to coach you through, hey, like I was in school till I was 30, and a lot of that was herbal education. So if you have a practitioner who's able to coach you through that and find out what is going to be optimal for you, that's really what we want.
That actually answers a question that I constantly get. I mean, I have patients, I get phone calls from patients all the time calling me and essentially saying, I already know what I need. Why can't you just give me what I need? I already know I have sleep problems. I already know I have cold. I already know my herbalist told me to take A, B, and C. Why can't I just go online and buy it? If you're not going to sell it to me, I'll just go online and buy it.
So like a patient who has taken a formula in the past, like they've taken Shaosan in the past, which is
Yes.
a formula that's marketed really well for
Yes.
stress, or for PMS. And so then they call you up and they say, oh, I've, had this from my practitioner in the
Oh,
past.
yeah.
Why can't you fulfill it for me?
Exactly.
Okay. So yeah, let's address that. Herbs are regulated in California, different ones at different levels, but particularly when you have herbs of good quality that are from a manufacturer that is actually testing that the proper herb that is in that formula labeled is what's actually in the bottle. When you get to those high quality herbs, you absolutely are going to have to see a licensed practitioner who's going to prescribe those. You're not going to be able to get a KPC product off the shelf at CVS, at GNC, nor should you be able to, because it's herbal medicine.
Mm-hmm.
It's not just something that, you throw in because you think that's what's going to happen, help with your stress. You might start out with a formula that works really, really well for you.
Mm-hmm.
So you might start out with Shaosan and you think that's like life-changing and it worked
Yes.
really, 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 really well. But the whole point is with herbal medicine, we're addressing the underlying cause. So one would hope that your underlying cause is improving, no?
Mm-hmm.
So if you are prescribed the proper formula and your symptoms are improving, again, it's not like a pharmaceutical medication that you should have to keep that going till the end of time.
Mm-hmm.
It's something that you should eventually be able to get off because your body has been coached how to do this on your own, or you've adjusted the factors in your life that are contributing to that being a problem to begin with. Or at the very least, your dosage is going to have to be adjusted. You shouldn't need, as much of that formula as you initially did.
Mm-hmm.
Maybe we're doing less of that formula and we're starting to incorporate another formula as well. But that takes a trained practitioner who's spent years studying that medicine and how those herbs work synergistically together. It's not something that is going to be the same 6 months from now. I think, how is that any different than, a patient coming into my practice and saying, well, I had a needle here before, put the needles in these places. Well, I know that worked for you in the past, might not right now.
Yes.
And as someone who has been really educated in this medicine, like, I want to give you an optimal result, not just a good result. So I think that's like the thing we need to keep in mind, like what is good versus what is optimal.
So what can practitioner do to help educate that to their patients? Like, you can't just call KPC or any manufacturer and say, give me this herbs, or you can't just go online and Google and Amazon. I can buy any other product that shouts, and who cares if you don't want to sell it to me, someone else will. So what is the advice that the practitioner can give their patients?
Okay. I am going to say this as tactfully as possible because our profession can be a little sensitive.
Yes.
But that is your job as a doctor, as a practitioner, as a licensed professional, to educate your patient. It is not the patient's responsibility to know how this works. And I know that there are a lot of amazing practitioners out there who, also feel like they just don't need to explain themselves and the patient's getting better. So why do we even need to have this conversation? But that creates a ripple effect, and it creates a problem within the entire paradigm of how we're operating, right? So I understand, like, maybe you don't want to be a public speaker, or maybe you don't want to work with legislation, or you don't want to help advance the medicine. But fact of the matter is, like, this medicine is advancing. It is we're really attempting to provide access to patients and make this more mainstream. And you as a practitioner happen to be in a field that is integrating right now, and you have a responsibility to explain that to your patient. I know people get busy, but that's not an excuse to tone it down when it comes to patient care. And if you think that educating your patient falls outside of patient care, you're absolutely incorrect. It is your job to tell the patient, okay, I'm giving you this herb. This is going to last for 2 weeks. This is what you should be anticipating. This is what we're looking for. This is when we're going to check back in next. And this will be the most likely result. Those all should be falling into your conversation with your patient when you're getting them on an herbal formula. And if you don't care enough about your patient base or your practice to do that, please know that if you don't do this properly as a practitioner, that person turns into somebody who goes and tells someone else, oh, I tried herbal medicine, it doesn't work. Oh, I tried acupuncture, it doesn't work. And we can't have those people going around. There's something much larger than ourselves as practitioners we have to think about here. And yes, at the very core of that, it's educating people. And you don't have to be, a teacher in a room of 100 to educate. I'm talking about you one-on-one with your patient, telling them that this is how this process is going to look, and making sure that they're properly cared for.
I think that's very important, like what you said, especially given the dynamic of our current situation right now. You're not seeing your patients face to face, so you're maybe doing just web or Zoom meetings with your patients. It's important to educate them and not say, hey, just go online and purchase it. Just call KPC, because that creates such a ripple effect. And that does. People come to me and calls me and say, well, my practitioner just told me to call you. So then I wonder what kind of, as lightly treading as this is saying, it's like, I wonder what kind of practitioner that doctor is now, because how can you just tell your patients to go find someone else to solve their issues? So
exactly. It is our responsibility as practitioners to do that educating. The patient doesn't know, just as a patient doesn't know, they're like, oh, I tried acupuncture for my back pain, it didn't work. Okay, well, how many times did you go? Once. They didn't tell me to come back. Okay, how long did you have that back pain for? 20 years. Okay, well, again, dosage is everything. So there's a huge part of that conversation that needs to be happening on every level when it comes to our medicine, because we do work in a different way than Western medicine works. And if patients are understanding of the Western medical paradigm, it's our job to put things into terms that they understand. So translating our medicine into a paradigm that makes sense for them, you know, saying that like, you're not going to take this same herb at this same dosage for the rest of your life, which is what you've been told with your high blood pressure medication. It's going to be a different process, because how would a patient know that? You know, when I have patients take capsules and they're like, this is like a lot of medicine. It's like 8 capsules every time I take a dose. And I'm like, yeah, because herbs are a lot milder. You're not going to have this knockout effect right away. But it's coaching your body on how to do it on its own, because your body already knows how to heal. We're giving it support. We're not shutting anything down. But if you're not having those conversations, of course, patients are going on Amazon and looking at herbs. Of course, they're calling you because they still have their KPC bottle from when they saw an example. Like, what if a patient saw, you know, a practitioner a year ago for chronic stress, and they were prescribed Shiosan, and they dig into their supplement cabinet where they have all of these things, and they call you up because they see the KPC label. And they're like, well, this helped me for my stress a year ago, and now I'm stuck in the house because of COVID and I'm really stressed. That might be the exact opposite formula of what they need right now. But their initial practitioner never told them like, hey, this is not going to be appropriate for you beyond X time. You need to be following back up with me. And right now, with telemedicine, is the perfect time to be following up with patients, following up with people that you haven't spoke to in a few months. You know, maybe those people who are transplant, they come in here and there, just checking in and saying, how are you feeling? What's going on? Just wanted to touch base with you. And maybe that morphs back into a current, you know, patient, and maybe it doesn't. Maybe it's just someone's life that you know, affected by reaching out to at a time of need, which this is a time of need for everyone, like whether, you know, we're feeling that in this moment or not. Anyone would be appreciative of someone reaching out, just saying like, hey, wanted to see how you're doing, and see where that goes.
I love that you share that story, because I actually get that question a lot on my end. I have patients that calls me and say, I got this herb a year and a half ago. My practitioner gave it to me and it works. Now I'm out of it. I need another bottle. And I'm like, okay, well, that's a year and a half ago. Have you reached out to your practitioner? Or they said, you know, well, with the current condition, I can't find my practitioner, which again, it's another point that you mentioned. Well, practitioners, this is a great opportunity to call your patients. Most of us are working from home. Most of us are, lack of better words, bored at home. So call your patient, reach out to them, say hello, check in with them, see what's going on, reconnect. And that's very, very important to do. So
and don't be afraid to be a resource. Like, it's okay. You know, now it's a little more flexible with telemedicine. Like, even if people are, you know, quarantined across the country, you can still speak with them. But if, oh, Rose, you went dark. Oh, there we go. But, you know, I've always been someone who likes referring to other practitioners. So like, if I have someone who's bicoastal, I want to lean on my New York colleagues and hook them up with someone there. And so even if that's what you end up being for someone at this time, by just reaching out to an old patient, and just making sure that you're continuing to educate, I think, yeah, it's important. Just touch base with people right now.
So I have a couple more questions because we're coming to the end. So one of the questions I want to ask you is, with this, so even though you're seeing face to face with like you and I connecting right now, it still sometimes feel a very distance, because in our herbs, in our traditional Chinese medicines, part of that connection, connecting with your practitioner too, to be able to get the proper diagnosis. What are you doing differently to make sure you give that personal connection, even though we're not personally connected?
Yeah. So I actually love it. And I feel like this is in some ways better than in person, which people would be really surprised by. Because if someone comes into my office right now, I'm in a mask and gloves. It's not like very personal. So I've done consults virtually and then have them come in office, but I make sure that first point of contact is here, like you and I are right now. But I'll have them send I mean, they fill out all of my usual paperwork in great detail. And then I also have them send a picture of their tongue right before the session, like immediately before we hop on this call, because sometimes with video quality, that can be a little challenging.
Mm.
I have always been someone who loves tongue diagnosis, even more so than pulse diagnosis. So it doesn't feel limiting to me. It feels strikingly accurate. And particularly, you know, I want the palpation more for acupuncture purposes. So if I don't have that, I mean, I can still very accurately prescribe herbs. I can still very accurately talk about nutrition and lifestyle factors. I don't need the palpation for that. And, you know, I've even with acupressure, talked patients through like feeling different points on their body, which is a really cool experience for them to start paying attention to, like, oh wow, it is like warmer here than here. It's like really cold in my lower abdomen. So because I like educating and I like patients to feel empowered and know what's going on with their bodies, that's how I've adjusted, and I've felt like it is very personal. And I think people have been genuinely surprised by how personal it is. And I have a patient now who this week is seeing me 5 times on a virtual session, which I never thought would have been the case. But, you know, she has a sinus thing going on and it's necessary. But that is working. Virtual is working pretty well.
Wow, I totally forgot about the point where, you know, right now it seems like when I'm in the office now, I feel so distant actually, and actually unapproachable because we're in a mask, we're in a glove, and you just can't see people's face. So this
actually feels better.
Yeah, exactly. This actually does feel better.
It does.
We're coming to an end, and I have one last question for you. So you talked about lifestyles and obviously combining herbs and different things just to make sure we are pushing our body in the right direction. So do you have any lifestyle tips that you can give to the people that are listening, either practitioners or patients, that they can do to benefit their own body while taking these herbs or while doing acupressures and different health tips in their life right now?
Yeah. So I would say the things that we forget to do when we're home are what we need to be doing. So drinking a lot of water.
Okay, I failed that.
Right. Because a lot of times when we're like out and about, or when we're working out or outside, we feel the need to drink water. We're like stuck in the house. A lot of times people are just not thinking about it. They're on their computers. So I would say make sure your hydration is on point. I always used to say 50% of your body weight in ounces. And I recently met a doctor who was like, you should tell people 80. He tells people 80. Because it's really hard to get there, and everything we're doing dehydrates us. So like air conditioning dehydrates us, stress, like, so really hydration is key, and movement, because we are not moving like we need to. So it's like, I don't care if you have to set a timer. This physical therapist I work with calls them movement snacks. So like throughout the day, like she'll get up and do like a few stretches, a few core exercises. It does not, I mean, I would love it if everybody, you know, took 45 minutes a day to work out. That might not be realistic for someone right now. It might not feel good, but you getting up for 5 minutes every hour and moving will do wonders for your circulation. If you don't have proper circulation to your brain is not going to work really well. So what you're trying to focus on the computer is not going to make as much sense. So hydration, movement snacks, and things to keep stress and inflammation to a minimum. So hydration and movement do that. But a proper wind down routine. I always tell patients, if you can own the first and last half hours of your day, that sets you up for so much success. So if you're really, really conscious about what input is going into my brain and my body for my first 30 minutes and for my last 30 minutes, which means no screens, which means no stress, which means like, are you moving? You can stretch, you can brush your teeth, you can journal, you can make a to-do list for the day. Just really own the first and last half hour of your day. And it will make the rest of the day feel a little less crazy and a little less stressful if you can do those 3 things.
This is awesome. These tips are wonderful. I actually don't do any of those, so now I need to listen to you. No wonder I'm so stressed. But those those tips are actually very, very important. It's simple yet important. Drinking water, moving around, because we forget we just sit on couches all day now. Being on computer all the time, you know, with us kind of at home just watching TV and being on our screens. So all those things, and only the time to yourself, giving time back to yourself, are all simple yet important. So we're coming to the end of the session. I just want to ask
Yeah.
if you have any additional things you'd like to share before we end the session.
No, just if you all have any additional questions, I'm happy to answer them. You can find all of my information, I think both of our information, listed on here, and Rose is going to save this video. You can also go to bewellwithdrnell.com. I have a podcast that people have been really liking at this time. It's all about integrative medicine. So I have different practitioners come on and talk about different things of value. And there's always like the helpful hints at the end for things people can be doing. Also a lot of like free resources for students and practitioners that I've been adding to my page, and my ebook will be out soon. So just go to bewellwithdrnell.com. Tons of resources for you guys there, and feel free to reach out here at Be Well with Dr. Nell if you guys have any additional questions.
Well, thank you so much, Dr. Nell, for your time. And just
thanks,
again,
Rose.
You're welcome.
It's been good chatting with you.
Well, I'll see you soon, hopefully.
Yes,
and so
soon.
Again, guys, just remember this video is going to be online available, and Dr. Nell has tons of great resources available online. Again, just visit her Instagram. I love visiting her Instagram because I always get inspirations myself. So again, thank you, and hopefully everybody stays safe and healthy in this time. Thank you again.
Thanks, Rose. Talk soon.
Bye.
Bye.